Hi, this is Minister Joannides with the Optimum Academy Heart 101 series, video number 5, echocardiogram findings. So let's get started. So when someone is listening to a heart, that's called auscultation, and you can hear heart sounds and detect certain illnesses or maybe congenital heart disease findings or damage to valves or other things by listening through a stethoscope. And naturally, you have to be expert at it in order to detect these sounds and what they particularly apply to in terms of diagnosis. So that's auscultation, listening with a stethoscope. Another method of detecting what's going on in the heart, which actually gives you a visual picture, is an echocardiogram, which uses echoes and allows the technician to record pictures that can be read by an expert to determine what's going on inside the heart and how the blood is flowing through the heart. So that's an echocardiogram, or sometimes just called an echo. So what do we use an echocardiogram to look for? And typical things would be left ventricular hypertrophy from high blood pressure, looking for things like hypertrophic cardiomyopathy, where the walls of the left ventricle are enlarged in a particular way, asymmetric septal hypertrophy, where the septum, that's the wall between the right and left ventricle, is enlarged, oversized compared to the other walls of the heart. Or we may look for things like fluid around the heart due to pericarditis, just generally cardiac enlargement to see what may be the underlying cause of an enlarged heart. We can check to see if the heart works poorly in diastole, and that would be diastolic dysfunction. Or we may use the echocardiogram in things like congestive heart failure with a low left ventricular ejection fraction. And if you happen to encounter a case like that in your underwriting, you would want to look for things like a very high blood level of NT-proBNP, which we will talk about in a later webinar, or a drug like Entresto. So, using an echocardiogram may help with any of these particular diagnoses. So let's look at the pictures at the bottom. On the far left would be kind of what a normal heart would look like if we were able to look at it with an echo. Of course, these are just graphic representations. Looking at an echo tracing is difficult, and we'll leave that to the experts to give us the diagnosis. But this kind of gives you an idea of what the echocardiogram would detect. If you look at the second picture from the left, you would see that the walls of the left ventricle, which is in red, are much thicker than they were in the normal heart to the far left. So hypertrophy of the left ventricle would look like that. And so the wall in between the two ventricles is the septum, that's enlarged, and then the other wall on the outside of the heart is also thickened and enlarged compared to normal. If you look at the picture to the far right, this compares a normal heart on the left with a hypertrophic cardiomyopathy, where the walls are super thick and the left ventricle has very little space for the blood to accumulate in the left ventricle and be pumped out. And in addition to these super thick walls, which limit the amount of blood that can be pumped, there is actually a disalignment of the cell structure of the heart muscle in these areas of hypertrophy. And this can contribute to sudden death in families. So to give you kind of an idea of how we use an echocardiogram in valvular disease, I wanted to kind of use these pictures, which may help you figure out what's going on inside the heart. So using a little license here, we're going to use drainage. So what's the difference between prolapse of a valve with regurgitation versus valve stenosis? So to the left, if your valve prolapses or goes the wrong direction, like this lid is raised up and the water is flowing out where it's not supposed to be, we can consider that a prolapse of the lid or valve with regurgitant flow. And so that's why all the water is backing up and coming out of that area. So kind of gives you an idea of what happens with regurgitation or insufficiency, if those words are used regarding valve disease. To the right is if we have valve stenosis, or where the fluid should be able to flow freely from one chamber to another, it's blocked or stenosed. And here you can see there's a whole bunch of debris which is blocking the flow, but you kind of get the idea that stenosis is a blockage. So here's the difference between these two words, regurgitation or insufficiency and stenosis. So we use an echocardiogram to determine all sorts of findings within the heart. So possibly you've heard of atrial septal defect, abbreviated ASD, and that means that in the septum of the atrium, which you can see in the picture to the upper right, there's a hole between the right atrium and the left atrium, and blood can flow through that hole or the atrial septal defect when it's not supposed to, and that causes problems. So an atrial septal defect would need to be repaired usually, and the echo would be one way of determining if that is the problem. A ventricular septal defect in the picture to the far right shows that there's a hole in the ventricle wall between the left ventricle and the right ventricle. So that would be a ventricular septal defect, abbreviated VSD. So you may see these terms used in an APS, and it may be that the person who is applying now for life insurance had a repair of those issues when they were a child or much younger. Another reason that an echocardiogram may be used is to determine if there is mitral valve disease. And as we talked about, does the water or the blood, the water in the picture to the bottom, is it regurgitating back through the valve, just as blood would regurgitate back through the mitral valve? Or is there stenosis? So it's difficult for the blood to pass through the mitral valve, and it's blocked. Also, an echocardiogram is used to assess mitral valve prolapse. So the mitral valve is going in the wrong direction when the ventricle is contracting. Just as with mitral valve, also echoes are used to assess the aortic valve. And the same two things can happen to the aortic valve. It can allow regurgitation, or it can be blocked by stenosis. So you may see AR or AI for aortic regurgitation or aortic insufficiency, or you may see the abbreviation AS for aortic stenosis. Now, sometimes the aortic valve, which is supposed to have 3 cusps, only has 2. So there's a congenital defect. The 3rd cusp just didn't happen in the natural growth process of the heart. People with bicuspid aortic valve often go on to have lifelong problems and may need at one point or another to have surgery to repair their bicuspid aortic valve, which may tend to stenose over time. So an echocardiogram is often used to assess whether a bicuspid aortic valve is present, and if so, it would be followed with an echo over time to see if there is any continuing deterioration of the aortic valve. Additionally, an echo could be used to assess the size of the aortic root, where the aorta attaches to the left ventricle. Is it dilated, which may be a problem because it could rupture at some point in time, or are there problems with enlargement of the ascending aortic artery causing an aneurysm? And if so, that could be a problem in the future, and surgery may be necessary for that type problem. So an echo could be used to follow those issues as well, aortic root dilation or any ascending aortic aneurysm. Just additional pictures to help you understand the atrial septal defect and ventricular septal defect that I mentioned previously. You can see in the picture to the left that the blood, which we'll consider the red arrow, can actually move from the left atrium, which is higher pressure, to the right atrium through a hole, which is the defect. And in the picture to the right, you can see that there's a hole in the septum so that blood can pass from the left ventricle to the right ventricle. So we have the atrial septal defect and ventricular septal defect. Just to give you a little further color on the mitral valve prolapse, to the left is a typical heart with the attachment of the mitral valve as it normally is structured. So blood flows from the left atrium through the mitral valve to the left ventricle. In the picture to the right, what happens is instead of the blood all going from the left atrium to the left ventricle, the valve allows blood to regurgitate back into the left atrium because the valve is prolapsing. So the combination of the diagnoses mitral valve prolapse with mitral regurgitation, you may see noted in an APS. Here's pictures of what I was describing about the aortic valve. Normally it has 3 cusps, but in some cases there are only 2 cusps, so it's called a bicuspid aortic valve, and it tends to get damaged and stenose as time goes on, as the picture to the bottom right. Here are pictures of different types of aortic aneurysms. Obviously, any major enlargement of the aorta is dangerous, and sometimes it needs to be repaired so that it doesn't blow out on an emergency basis. So the echo can be used to assess for aortic aneurysms and how things are progressing over time. So as I said, surgery may be necessary to repair those kind of defects. Just as an additional topic, I just wanted to mention coarctation of the aorta. So in some cases, as a congenital defect, coarctation of the aorta can occur, and I've put a red arrow to show you what exactly is happening. So where the aorta should be nice and wide with a wide lumen, there's a very narrow area, and that narrow area causes all kinds of problems because the blood isn't flowing sufficiently through that area. This may be accompanied by a bicuspid aortic valve that I just talked about, so it wouldn't be unusual for somebody to have both problems. So then they would have two major issues to contend with. So often the coarctation of the aorta is repaired surgically, but there can be post-operative problems many years thereafter. So it's good to keep tabs on the status of the coarctation and how the life insurance applicant has progressed over time. So that completes this video in our Heart 101 series. Please continue on with us as we develop our Optimum Academy and view other heart and other videos that we have produced for you.